Because as soon as you get in, you just put your legs up in the air in this thing, and your hoo-ha is like, hi. 1 minute you're meeting the doctor and trying to figure out how to pronounce his name, and the next minute your hoo-ha is cracked open like a walnut on Christmas. Hi everybody, I'm Tanika. Thanks for clicking on Simply Tanika. Today I have an update for you. I had my HSG test. What is an HSG test, you ask? Good question. It is a hysterosalpingogram test. And what that means in English is they insert dye or contrast into your uterus, and they're checking to see if there's any abnormalities in your uterus or your fallopian tubes. I was told going into it a couple of things. One was to take pain reliever in advance of the procedure because I would expect mild to moderate cramping, and so they, to have it in my system before I got to the doctor's office was what the recommendation was. I was also told to be prepared to wear a panty liner afterwards, that there would be leakage, so no white clingy clothing, just in case. The other thing I was told is that the test needed to be performed between cycle day 6 and cycle day 10. I am currently on cycle day 8, so that worked out perfectly. And then they want you to attest that you are not pregnant, so that you have an HCG level of 5 or below. So you have to sign something saying you are not pregnant. I had my blood work done on cycle day 3, and so I knew I wasn't pregnant. Those were all of the things that I was told up front going into it, and then I went in for my appointment. So I did take some footage. I'll show you guys that now. So I am headed to my HSG take 2 because I didn't have my proper insurance paperwork and I had to go back to the office, so we've rescheduled it. So So I'm here in the radiologist's office and waiting for my HSG. Cheyenne is filming me. Thanks for coming. We just found out she's not going to be able to go in with me though, apparently. Radiation, not a good idea to have visitors. So this is the before. I've taken 6 Tylenol. They recommended to take Tylenol before the process started. I was originally meant to have this done at 1:30 or 12:30, and there was a mix-up with the insurance, so I'd taken 4 Tylenol, and then now I'm back and it's later in the afternoon. It's 4:30. I don't know if you could see the darkness, and so it's dark outside, and so I took 2 more, so I've had a total of 6 Tylenol. And so yeah, they recommend you take Tylenol before and that you bring a panty liner. Apparently there's going to be leakage afterwards. Just finished the HSG test and everything is clear. It was literally like 10 minutes. I went in, I talked to the doctor, got undressed, then went into the radiation room. Glad that I talked to the doctor because as soon as you get in, that's gonna be an audio. Glad that I talked to the doctor beforehand because as soon as you get in, you just put your legs up in the air in this thing, and your hoo-ha is like, hi. So glad I got to meet him first with my clothes on. But anyway, all's clear. Took Tylenol before, I said that right. There was some leakage afterwards. He said there should be some leaking. There was mild cramping, but definitely cramping. Even though everyone said that, I wasn't expecting it to happen. It did, and he just had me take like a lot of deep breaths and then hold my breath for the pictures, and they'll send that to my RE today. So that was it. So yeah, that was my experience. 1 minute you're meeting the doctor and trying to figure out how to pronounce his name, and the next minute your hoo-ha is cracked open like a walnut on Christmas. Shout out to Cheyenne for coming to the appointment with me. Thank you, Munchkin. So yeah, everything went well afterwards. I think while the procedure was going on, there definitely was cramping, which even though they told me that it was coming, it wasn't what I expected. So they're pushing the contrast dye into your uterus. So first they put the speculum in there, let me go back. first you get on this table, you hop up, and then you just have your legs like spread open like this. There's no, normally when you go to the OBG, like you are at least, there's like the little sheet covering or whatever, and then you kind of like reveal. Nope, none of that going on here. You flip your legs around and up they go into the air, into these little things. And he's like, just relax your knee. And, you relax your knee, damn it. Anyway, so we did that. And he pushes the dye in there. So he says, okay, you're going to feel my hands and pressure. So he puts his hand like on the outside of everything, basically like on my butt cheek. At TMI warning, if you're squeamish, you look away, or go to another video. So he puts his hand there, then he puts the speculum inside of me, and he talks me through it as it's going. He points over to the screen on the right and says, tells me what I'm going to expect. He says I'm going to push the dye in, and it just feels like a lot of pressure while it's going in. And then he expands a balloon once it's in there, and that's when the cramping starts. So there just feels like there's a lot of stuff suddenly inside your vaginal cavity and then pushed into your uterus there. You feel all of that. So, and then you see it on the screen, the dye as it enters, it shows up white on the screen, and he's showing you that little triangle is your uterus. He asked me if I had any fibroids or history of fibroids. I said no, and he said, okay, well, your uterus is tilted to the right. It's not abnormal. Sometimes it happens when women have fibroids, but it's not abnormal in and of itself. And then he showed me where the fallopian tubes were. And they always tell you like it's like a little spaghetti, but it really does look like spaghetti. It's very tiny, very narrow. The dye pushed through on both fallopian tubes right away. We could see it on the screen. And then he told me, everything looked great, and he would send a report to my RE today. And then he also gave me a printout, or the front desk gave me a printout. But basically what it says, it gives you what the procedure description was about the balloon. It says the patient tolerated it well. Then he said the findings were the size and shape of the uterine cavity were normal. The uterine cavity was angled toward the right hemipelvis. There was prompt contrast opacification of both fallopian tubes, so the opaqueness, you could see that on the screen. And then the fallopian tubes were normal and coarse and caliber with free peritoneal spillage bilaterally, which means the dye just went through and spilled as it was. It wasn't sluggish. It didn't get stuck and then suddenly cleared. Everything was fine. And yeah, you could just see it on the screen. It pushed through right away. So hopefully, now that we know everything is normal, if there was anything remaining from, my miscarriage, it's all been knocked out because rumor has it, or evidence shows that the 3 months immediately following the HSG shows increased fertility results for women. So people get knocked up. So hopefully, that'll happen for me. So yeah, that is basically it for the HSG. He did tell me that I might need to take additional Tylenol in about 4 hours. It will wear off. I think it all went well. I'm excited, and although I'm sitting this cycle out, I feel like I'm doing good things to prepare for the next cycle. If you have any questions about the HSG test, please let me know. Leave a comment below. If this video was informative for you, please give it a thumbs up, give it a like. Or if you know someone who is going in for an HSG test or has questions about it, please share this with them. And if you haven't subscribed yet, please subscribe. If you click on the little notification bell, you'll be notified whenever I upload a new video. Videos come out every Saturday, and then if I have extra things to talk about, I'll drop them, throughout the week as things come up. All right, everybody. Thank you for watching. Bye.